Good morning. I'm Irish Luma, BSN3 weekend class. Today, I'm going to perform the diaphragmatic breathing and coughing exercise. Before anything else, what is diaphragmatic? Diaphragmatic breathing is a relaxation technique that involves using your diaphragm. It strengthens your diaphragm and fill your lungs with air efficiently. To perform the diaphragmatic breathing, first, uh, always remember that in every procedure, you should wash your hands before and after procedure. Then, uh, you should, in entering the patient room, you should greet the patient, introduce yourself, and explain the procedure to the patient to gain more cooperation. Then, identify the patient. You may ask his name and check his wristband. To start the procedure, place the patient in comfortable position. It can be seated or lying down. So, in diaphragmatic breathing, pwede na day siya sitting, pwede po siya maghiga. So, since ma'am assuming that I'm the patient, so place the patient in comfortable position. So, ana na lang, sandig na lang ta. Then, instruct the patient to place one hand on the chest and the other hand on his abdomen. So, and then instruct the patient to inhale slowly and deeply through his nose, keeping the mouth closed to expand the abdomen. Then, instruct the patient to exhale slowly through his forced lips and filling your abdomen full. So, dapat katong mura siya gunaay mo whistle iya ang inig exhale. So ani. So gikan sa pag-inhale, count 1 to 7 in exhalation. So count in your mind na lang. So pag gikan dire, so like this. So, katong na tingog. Na again. So, nikuan imo ang abdomen, raise, ni expand. Like that. Instruct the patient to use the diaphragmatic exercise 5 to 10 minutes 4 times a day. Always remember, if the patient is COPD, teach the patient the double cuff technique. And if the patient is having a difficulty in raising the abdomen, instruct the patient to do forcefully and quickly in inhalation through the nose. So, kuan lang inani lang kung ang patient is kana maglisod bitaw siya og kunang maglisod bitaw, if the patient is maglisod bitaw siya og raise sa iyang abdomen, so kuan na lang, paspas na lang nga ginhawa. Ana lang. So, that's all for the diaphragmatic breathing. Let's proceed to the coughing exercise. What is coughing exercise? This is a natural defense mechanism to protect the lungs and airway from inhaled particles, foreign bodies, and excess secretions. The purpose is it helps loosen and clear mucus from the lungs, especially after surgery. So, to perform the procedure, place the patient in semi-polar position, leaning forward, so like this. Semi-polar, so naghandag lang, ana lang. Semi-polars. And then, leaning forward. Provide pillow or folded blanket to protect the incision site. So, para dili kayo siya mulihok, inig-ubo niya. So, Below. Let the patient inhale and exhale deeply and slowly through the nose 3 times. So like this. Instruct the patient to take a deep breath for 3 seconds. So, deep breath. Hack out. Hack out for 3 short breaths. Again. Then, ask the patient to take a quick breath and let him cough once or twice. So, quick breath. Again. Repeat the coughing exercise every 2 hours while awake. Try to avoid prolonged coughing.